Okay. My name's Andrew Davidson. I'm 30 years old, and I tore my right ACL in a skiing accident on the very best powder day of 2011, which would have been March 20th. The very next day, my wife took me to the Stone Clinic, and she's a veteran of 5 reconstructions at different offices herself. So she'd been doing the research beforehand and knew that this was the place to go to. I was seen approximately 18 hours after the injury, and they put me right into PT, and that was fantastic because all the pain medication and everything, the brace that they give you in the emergency room just did nothing. And 5 minutes into PT, my knee was feeling much better. After 2 weeks of PT, I underwent reconstructive surgery. It was incredibly easy. I was in the surgery center at 7 in the morning, and I was wheeled out in the wheelchair. Not that I remember much of it, but wheeled out at approximately 9 o'clock that morning. Recovery was surprisingly quick. I spent about 4 days around the house, and after that was able to move around fairly easily on crutches. I was able to return to work 10 days after the surgery. I work at a desk job, so it wasn't particularly difficult, but I was very surprised that I had very limited swelling from sitting in a chair for 8-10 hours a day so soon after surgery. The Stone Clinic was great in that the PT facilities are in the same building as the MRI machine as Dr. Stone. It's all in one place. You don't have to go from waiting room to waiting room for appointments. You just go from seeing Dr. Stone to going to the MRI to seeing Dr. Stone to going to PT, and it's a one-stop shop. I hit PT really hard. I went 3 times a week for about the first 3 months, and my goal was to get back to skiing by January, which would have been 9 months after the injury. At 6 months, well, I should back up a little bit. At 2 months after the surgery, Dr. Stone said, "Go ride a bicycle outside." And that was some of the best news that I had because I hadn't been able to do much that wasn't in the gym to that point. At 3 months, Dr. Stone said, "Go ride a mountain bike." And I asked him, am I risking hurting the graft? And he says, if you fall, you're probably going to hurt your head first, so don't worry about it. At 6 months, after I had whittled down the PT schedule from 3 times a week to 2 times a week, and then finally down to 1 time a week right around the 6-month point, Dr. Stone cleared me to go skiing, which was fantastic except for the fact that we had no snow in Tahoe until about January. At my 9-month post-surgery, I said, forget the low snow in Tahoe, I'm going to go up to Whistler and go skiing. It was a trip with my father, and I thought, what better way to get back into skiing than, go on a couple of mellow runs with a 60-year-old. And much to my surprise, he'd booked us on a trip with an extreme skiing steeps camp with some former Warren Miller skiers. So my reintroduction to skiing was going down a couple double blacks at Whistler, which was a lot of fun. I have to say that I was very mentally and physically prepared to do this. Dr. Stone put me through some return to sport tests, which were testing, lateral agility, the ability to jump and land, the ability to accelerate and decelerate, and the peace of mind that gives you before you going back to sport is phenomenal. I can't say that I skied particularly well my first run back, but after a run or two, the confidence returned, and it's been good ever since. I just had my 1-year checkup. It's flawless. It's fantastic. It's great to come back to see that everything is going well, and it's great to have Dr. Stone being a part of going forward. As a side note, my wife was so impressed with how well my surgery and recovery went that she decided to come in and have her left knee operated on for the 5th time, to have her ACL reconstructed, to have her posterior lateral corner reconstructed, which her prior surgeons had missed the injury to that. She had a femoral condyle repair with bone grafting, and she had a meniscus repair. And lo and behold, at 9 months, she's skiing as well. So we're strong believers in the Stone Clinic. We hope never to have to come back here again, but if it happens, we know that we'll be back here.